skills is providing perineal care. So the purpose of this skill is to remove normal perineal secretions, any odor, and to promote also client comfort. So assessment, let's assess any presence of inflammation, swellings, pain, odor, or discomfort. Next is for our equipment. We have bath towel, bath blanket, clean gloves, basin with warm water and soap, and also washcloth. So for our implementation preparation, let's determine whether the client is experiencing any discomfort or in their perineal area or genital area. Also, let's obtain necessary equipment and supplies. And next is for our performance. Prior to the procedure, let's introduce ourselves and verify the client's identity, and also explain what we're going to do and how she or he can participate. So, good morning, ma'am. I am Giselle Esteban, your student nurse for today. May I know your name, ma'am? Can you state your name and your birthday? Okay, Miss Papin, I am your nurse for today. So, ma'am, I'm going to perform providing genital or perineal care. So it is necessary to provide you comfort and remove any secretions from your genital area. So ma'am, you can participate by following all the instructions given to you. So next is let's perform hand hygiene. Done. And let's provide client privacy by closing the door or drawing the curtains. Done. So next is let's prepare the client. So let's fold the gown and expose only the genital area. So next is let's place a bath towel under the client's hips. So under the client's hips. So done. And next is let's position and drape the client and clean the upper thigh. So for our female clients, let's position the female with a back laying position with knee flex and spread well apart. Okay, knee flex. And next, cover her body and legs with a bath blanket and expose only the genital area. And let's mean this exposure lessen embarrassment and also provide warmth. Next is let's apply clean gloves. And then next is let's dry the upper inner thigh. So dry. Okay, discard. Okay, discard. And then next is for our male clients, let's do also the same. So position the male client in supine position with knee flex, slightly flex, and apply also gloves and wash and dry also the upper inner thigh. So next is let's inspect the perineal area. So let's note any areas of inflammation, excoriation, any swelling, and also any excessive discharge, secretion, and wash and dry the perineal or genital area. So in cleaning the area for female, let's clean the labia majora. So let's spread the labia, and wash the folds between labia majora and labia minora. So because some secretions around labia minora and labia majora facilitate bacterial growth. So let's clean using a 7-stroke. Okay, discard and then next 7-stroke and then discard. And also we can use also clean wipes or washcloth for each stroke and wipe from pubis to rectum. So by using separate quarters of washcloths or wipes, we prevent transmission of microorganisms. So wipe area from least contamination to greatest contamination. So we can use a wipes. Okay, so from 7-stroke from pubis to rectum, discard. And then next from pubis to rectum, discard. And then next is let's rinse the area well. So we can use a bedpan, okay, bedpan. And then next is also we can use a peri-wash solution and pour warm water over the area and dry the perineum thoroughly. So pour dry water. We can use also soap if there is, and then warm water. And then discard. So for our male clients, let's also do the same. So wash and dry the penis using a firm stroke. So if for example it is a penis, so if the client is uncircumcised, so let's retract and perfuse the to expose the gland penis. So retract. So by retracting, it can remove the smegma or the thick secretions, and also wash the gland penis using a circular motion. So from inner to outer, and then top to down. And also, let's wash also and dry the scrotum posterior folds. And scrotum needs to be clean. Okay, discard. And then next also, let's inspect also the perineal orifice for intactness, especially around the urethra. Urethra in a client or patient with indwelling catheter, because the catheter can excoriate or can cause excoriation around the urethra. Okay, urethra. And then next is let's clean between buttocks, and let's assist the client to turn inside facing away from you or facing away from us. So, let's assist the client inside position. And then next is let's pay attention to the anal area and clean the anus with toilet tissue before washing, and then dry it well. So, let's wash with toilet tissue and then discard. And then position the client in a proper place or proper position. So next is we are done. So let's remove the and discard the gloves. So discard. And then next is let's perform hand hygiene. Done. And let's document findings such as any redness, excoriation, discharge, or any tenderness. So for our evaluation, let's relate current assessment to previous assessment, and also conduct appropriate follow-up care, and also let's report any deviation from normal to the primary care provider. So now I am done in providing perineal care.